With the cold weather comes flu season. We're in the midst of it right now, and with COVID-19 still surging in the U.S., doctors warn of staying safe as it hits its peak. Tonight, Kalisha Moore talks with a doctor who gives us tips for flu prevention.
January is when flu season hits its peak, but doctors say as cases in Georgia rise, the best way to protect yourself is by getting your flu shot. Dr. Harry Strother says over at Atrium Health Navicent, patients have been packing doctors' offices for a lot of reasons.
For the flu, we're seeing COVID patients. We're seeing the combination.
The CDC is currently showing the state of Georgia hitting the very high spectrum for flu activity. With symptoms for COVID and the flu mirroring each other, Dr. Strother says there's only one way to tell.
You really need to have a test to distinguish between the two.
Once you're tested and you're positive for the flu, taking medicine early could get you over it faster.
There's medication that you can take if you start it within 3 days. It's better if you start it within 2 days. But if you start it within 2 or 3 days, then it can decrease how long you have the flu.
Some of that medicine, like ibuprofen for body aches, nasal sprays for congestion, and cough suppressants, can be prescribed or found over or behind the counter at a pharmacy. Struthers also says you've heard it before, but following the same social distancing advised for avoiding COVID is still key.
You wear masks. If you're coughing, then you cough into your sleeve. If you don't have a mask on.
Ultimately, he recommends the vaccine as the first line of defense.
Yeah, it's not too late to get the flu vaccine if you haven't already gotten it.
In Macon, Kalisha Moore, 13 WMAZ News.
As for children, those younger than 5 run the risk of having more complications with the flu. Both the CDC and Dr. Struthers encourages flu vaccines. Those as young as 6 months can get the yearly dose.